And even 20.
20 was approved. How many fruits do I need today? Like 5? Girl logic. That's what it's called in my house. Girl logic. How many of us are there? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14?
We're good.
Was that supposed to have crystals in it or no?
No.
So I think minority household.
14?
Just say.
It just doesn't talk about making rounds.
No,
There's 14. Okay.
Expired in 1995. That's a long time.
A couple of you wanted to get skull x-rays and CT scans. We can't do that. The reason we can't is because it's bacterial. Remember, it's almost 100% mortality rate. We've got to get treatment started quickly, pull the cultures, and start them on something. Usually Stillins. Okay, there's no rationale. Awesome. I guess it's me. I'll give you the rationale. So the answer was A. Patient with right-sided paresthesia and hemiparesis. My gosh. Was diagnosed with a thrombotic stroke. Over the next 72 hours, the nurse plans care with the knowledge that the patient is ready for aggressive rehab, will show gradual improvement of the initial neurologic deficits, may show signs of deteriorating neurologic function as the edema increases, should not be turned or exercised to prevent extension of the thrombus and increased neurologic deficits. Right-sided paresthesia and hemiparesis. What happens over the next 72 hours that the nurse is going to plan for? Somebody with purpose. Right?
That's a serious walk.
Somebody walking with purpose. Nope, it wasn't her. She doesn't have a We heard someone walking with purpose, but it was somebody in heels for sure. Okay? Oh, we're kind of everywhere. So you weren't sure pretty much if they were going to have deteriorating neurologic function or that we shouldn't turn them. That made up 50, 60, 80% of you were torn between C and D. So in the first 3 days, the patient will have an increasing edema. Usually the edema will increase. Even when they read that first CT, remember how we said 45 minutes to be read, 25 minutes through the door and they have to be in CT, 45 minutes it has to be read. Even on that first read, it probably won't show the extent of the edema. It will still increase over the next 48 hours, sometimes up to 72 hours. In that first 3 days, they're not going to be ready. The A is, what's going to throw A out is going to be the word aggressive rehab. They're probably still going to be extending edema and showing symptoms. So that's going to make B. C makes B wrong because we know the edema is going to increase. And we can go ahead and do some turning and range of motion with this patient. They shouldn't just be left, to not be doing any kind of exercise at all, especially if it's going to take potentially 3 days to get through the edema. We want to make sure that we do keep their joints, limber and prevent contractures that way. Okay, let's see what this one is. While performing health screening, the nurse identifies which of the following individuals at greatest risk for experiencing a stroke. So you're looking for strikes, right? 46-year-old white female with hypertension and oral contraceptive use times 10 years. 58-year-old white male salesman who has a total cholesterol of 285. 42-year-old African-American female with diabetes that smoked for 30 years. 62-year-old African-American male with hypertension and 35 pounds overweight. Now we're waiting on 15 probably. Ah. Okay, the 62-year-old African-American male with hypertension is correct. We know that hypertension is one of the most important factors in terms of stroke. So 2 of these patients are hypertensive, right? We have A that's hypertension and D that's hypertension. Of these 2, we also know that African Americans is higher in that demographic. So this person has 2 strikes. This person's white, so we're going to go ahead just based on those 2 with D. 62 just helps us out because at 46 she's younger. We know that strokes increase after the age of 55 with each decade. There is an increase. So this guy has 3 strikes against him. This one is African American also with diabetes who smoked for 30 years, 42. So it's the 62 and the 35 pounds overweight hypertension that's going to make that person at higher risk. A patient with a stroke has dysphagia. Before allowing the patient to eat, what should the nurse do first? Check gag reflex. Request a soft diet with no liquids. Place the patient in high Fowlers. Test the patient's ability to swallow with a small amount of water. Most of you wanted to check the gag reflex. What was D? Test the patient's ability to swallow with a small amount of water. Put them in high Fowlers. So we're going to check the gag reflex first. You're going to probably go ahead and put them in high Fowlers position before they eat. But before you even plan on that, make sure they can swallow. You're not going to try them with a small amount of water. Why not? Water is a thin liquid, and you don't want to promote thin liquids, right? Didn't you do thicket at the nursing home? If you were afraid of aspiration, you did thicket, not something thin. So you made the coffee thick. You made their water thick because it's easier for them to swallow if it's thicker. If it's thin, they're going to more likely aspirate. So high Fowlers was the other one you wanted, and we will get them in high Fowlers to eat, but not before we check their gag reflex. The nurse admits a patient with advanced Parkinson's disease with a cough and fever. During assessment of the patient, the nurse would expect to find slurred speech, visual disturbances, and ataxia, muscle atrophy, spasticity, and speech difficulties, muscle weakness, double vision, and reports of fatigue, drooling, stooped posture, tremors, and a propulsive gait. take the candy away. I was going to growl at you. He's not good enough to take the candy away. One more. I think we're waiting on one more. Everybody, sometimes I just feel like it dies halfway through. Okay. So most of you went for D, which is right. That's the typical description of this Parkinson's patient. What did some of you go for? Muscle atrophy, spasticity, and speech problems. The atrophy we might not expect more than we would the drooling and the stoop posture and the tremors. These are more characteristic of the person with Parkinson's disease. Muscle atrophy is probably a later symptom. Spasticity is not one of the ones we typically see. We see tremors. Spasticity is more related to multiple sclerosis. Beta-seron has been prescribed for the patient with relapsing remitting MS. The nurse determines that additional teaching, now if you haven't looked it up, you're not going to know. Additional teaching is needed when the patient says, I will need to rotate injection sites with each dose I inject. I should report any depression or suicidal thoughts that develop. I should avoid direct sunlight and use sunscreen and protective clothing when outside. Because this drug is a corticosteroid, I should reduce my sodium and intake to prevent edema. Beta-seron. And this is one of those you either know or you don't. You either know the med or you don't. This one might not be on your med list, but it was in the audio, so if you listen to that, you might know. Or if you read. I'm going to guess what that means. It's a corticosteroid. You either knew that one or you did. Oh, that's it. Questions? Questions on anything? When we meet again on Tuesday, I will answer and entertain questions on the self-learning packet that is sensory. I will answer and entertain questions on anything on exam 4. I will give you the synopsis for the final exam on Tuesday when we meet again. Thursday then is the exam. And remember, we will review that exam the following Tuesday. And also on that day, if enough of you stay, post-exam review, we'll do a final exam Jeopardy. We decided to review the exam at 11:30. Yes? Is that what time we decided? Do you want to come earlier? If we come earlier, is that going to help? Not if we still go with class at 12:30. You want to keep the time the way it is? It's fine by me. I don't care. Other semester students have said, can we, since we don't have anything in the morning. But I don't know. She's here. So you three are here. Do you want to keep the time at 11:30 for review and 12:30 for class to start, for Final Jeopardy to start?
Yes.
Okay, awesome. I don't care. No problem.
Tuesday after.
We've started sometimes at 10. Some students have said, let's get it over with. So I wanted to just throw it out. Everybody have a nice Thanksgiving. Eat lots of pie and turkey and mashed potatoes and gravy. And put on your scrub pants.
Which day was that?
What?
Which day is that?
What day was what?
The Tuesday? Is it
Tuesday? I have to
Tuesday?
pull the calendar up.
Tuesday.
Okay, so my mom called my insurance company and
So what's today? Here's a calendar.
So that's why I'm doing right.
So Tuesday the 29th is the Q&A, I think.
So I don't think I'm going to be getting it done on
And then, must be the first is the test.
Yeah, so the
And then the 6th
6th.
is going to be the review for the final and the review for exam.
I just want to make sure I put in there 11:30.
I'm surprised.
There aren't many left if that was a whole bag.
What were you saying?
That looks like what's left.
Where did you get them, Carla?
Oh, really?
He got them like somewhere else, like
Grocery store.
Oh,
But I have bought some around this way.
down here. What are they called?